Hi, everyone. I am Sue Heggie. I am an Associate Vice President of Care Plus New Jersey, which is a community mental health center in Bergen County. And I'm a licensed clinical social worker for over 20 years, and I'm happy to be here.
And I'm Dr. Hasmik Genovese, and I'm one of the emergency room doctors at Valley Hospital, specializing in pediatrics. And I'm also happy to be here to talk about this with you guys. Question 1. Is teen suicide a concern in Bergen County?
Absolutely. I know in Bergen County, just like other counties in New Jersey, teen suicide is a concern because we do lose teens due to suicide when we know depression is treatable. 90% of the time, when people die by suicide, there's a diagnosed or undiagnosed depression, anxiety, and we know that it's treatable if people were able to reach out for help.
I have to say, from the emergency department perspective, I do think that it's one of the more common psychiatric emergencies that do come in. So it is definitely very relevant to our kids today, and we need to try to help them get through this.
I think that, the medical and the mental health is very important because often people go to get medical treatment to see if, because a lot of the symptoms of depression or anxiety do feel medical, headaches and stomach aches, loss of energy. And so there's no stigma going for a medical exam. So we will see our youth that do go to those type of appointments, and then when they're medically cleared, then we're often working together to refer a youth that we think might have a mental illness like depression or anxiety for treatment. So it is great that a lot of doctors are trained in suicide prevention, just as well as us therapists. We always want to clear someone medically because sometimes it could be a loss of vitamin D or other medical issues that were not known, and then we can really look at how to help that youth.
Yeah.
We know that the pandemic, COVID, has definitely increased mental health concerns among youth because a protective factor for all of our youth is academic supports and success and social supports and success. And because COVID, with all the restrictions that happened, our youth did not have the connections that they were used to. And so that can create more anxiety and depression, and also less eyes on that youth to see the difference in their behavior or their verbal statements. So we know that suicide amongst teens were on the rise before the pandemic. We don't know yet if suicide deaths have increased during the pandemic, but we do know that depression and anxiety has increased to a level that is a concern because we still have restrictions and we've had losses with our families and our teachers and in different aspects. So I do know that really supporting kids during this time of transitioning back to schools is extremely valuable and important.
So it's actually an interesting phenomenon because although globally I do feel like adolescents and children do exhibit a higher level of anxiety, even in the emergency department for routine concerns, we had a significant drop in all emergency room visits in the height of the pandemic and the months afterward. The numbers actually have come back to pre-COVID numbers sometime in October when really the dust seemed to sort of settle out. But I'm not sure that that reflects the actual level of anxiety and suicidal thoughts, suicidal attempts in the community, because there's some people that still may hesitate to seek medical attention because they don't want to interact in a medical community because of COVID fears. And I think that we really, like you said, we really don't know how this has really manifested in terms of actual suicide attempts because the data just hasn't had time to filter through yet. All of us have a little global idea that things do seem worse, but nothing has been really proven so far.
Right. I noticed that in our agency, we definitely have seen more self-interest behavior.
Yes.
This type of behavior is not linked to suicidal behavior because the self-injury is to cope. It's a coping mechanism. These youth are trying to feel better, but we know it doesn't work and it creates more problems. But it's also a risk factor in suicide because if that child becomes depressed or more depressed, they've already shown this fearlessness with being able to self-injure, and that puts them more at risk for if they became more depressed or if they had suicide ideation, they've already had the rehearsal to then make an attempt. And so we know that we need to really treat that behavior of self-injurious type of coping skills because it could create a lot more problems.
What are some of the risk factors or signs and symptoms that adults should be aware of?
Okay, so I can just explain that risk factors, what that means is that these youth are more at risk. And warning signs is what to look out for, someone that you're concerned. As far as risk factors, we know that social relationships are impaired social relationships are the number one risk factor for those people that completed suicide or died by suicide. If you think about being a youth, a child, an adolescent, academic success and social success is everything. So if they're struggling academically or they're struggling in social relationships, that's 50% of their developmental level that they don't feel successful. And that, without the right supports and the resiliency skills, that could really lead somebody to have more complications with their mental health. So we also look for risk factors in past suicide attempts because if you've had a past suicide attempt, you're forever at risk because, again, you've shown that you can be fearless and go against the grain, and that's a problem. And we always want to monitor those youth that also have warning signs. And risk factors, it could be a genetic link for mental health issues. It could be a loss. It could be, the LGBTQ are a group that definitely are 30% more at risk to have depression and maybe suicidal ideation, and not because of their sexuality, but because we know their rejection from family and friends, or the perceived rejection, puts that group more at risk.
Yeah. We in the emergency room also see some, like you said, some factors that, do play into this is their historical, whether they've attempted anything in the past, like you said, self-injurious behavior, family history of other members of the family having caused self-harm or suicide. And, we start to see some behaviors that in the emergency room, such as withdrawn behavior, not wanting to interact with their parents, their family, not wanting to interact with the staff. Those are other things that we've seen as more or less signs that there may be something that needs to be delved deeper.
Yeah, I mean, the risk factors we have been seeing lately is the use of substances,
Right.
because we know that using different kinds of drugs and alcohol definitely increase the risk because these youth might be self-medicating, they might create some mood disorders. And we know that if you are depressed and you're using substances, specifically marijuana or alcohol, that make you feel even more depressed because those substances are a downer. And then what we do know is that using substances, if you are depressed and have suicide ideation, that being under the influence might give you the courage to do something that you might not otherwise do had you been sober. So that's why substance use disorders are such a big risk factor when we see youth that are struggling. Do you want to talk about some of the warning signs that is a red flag?
Yeah, definitely. So some of the warning signs that I think that can tip us off to somebody having an abrupt change in their mood is going from being very talkative to being very withdrawn, or even the opposite of being withdrawn and then suddenly very happy and euphoric, starting to use the substances that they never used to before. Do you have any others that you have seen?
I just want to pick up on what you were saying about, I think sometimes there's a trick. So you have a depressed child and they're really sad and withdrawn and not happy and not, doing their hair and makeup and caring about their grades. And this child used to care. And then all of a sudden they seem happy. They want to make plans. They started doing, and so we always want to be careful with somebody that we were worried about all of a sudden very happy, because we know that most of the time when you're feeling depressed and have suicide ideation, you naturally are trying to fight to live. It's a very hard place to be in the middle of should I live or should I die. It's just very stressful. And sometimes when a youth or adult, but we're talking about youth, make up their mind, I'm going to do it, there's a relief. There's a relief that they have made the decision, and it can create this illusion that they're happy and everything's fine. And we always are very concerned about that, because we know that suicidal behavior as far as youth, whether they have access to means, the number one method we know is gun. People die by gun, but with youth, it's asphyxiation, hanging. And so we really want to be careful to have restrictive means for children that we're worried about with a depressive state, that have said different statements that made us concerned, because we know that a lot of times people that make up their mind to die by suicide will start giving things away, which is a big warning sign. Saying goodbye, telling people how they appreciated them. We know that another warning sign is when children verbally tell someone, I want to die, I'm going to die. 50% of the time, that youth has told somebody, either through their behavior or verbal language, that they want to kill themselves. And that's why people that talk about suicide do then die by suicide. And we have to take every threat or verbal indication seriously, because we know that that's a warning sign that can't be ignored.
I very much agree with that. I feel like a lot of the youth that are referred to the emergency department have been picked up by friends, family members, school counselors or teachers, having made a statement, having written a note, having put something on Twitter or Facebook or what have you. And it is a major way that we end up kind of catching them and getting them the help that they need. What advice do you have for parents if their children or child is experiencing suicidal thoughts or ideations?
I think my advice always to parents is that we really need to see the full picture of what's going on with that youth. Sometimes youth will make a statement out of context, or they want to say, I'm feeling so sad, I hate myself, but instead of having the right verbal language, they might say, I want to kill myself. So we really need to take every threat seriously and do an assessment and really look at what's going on for that youth, and how either we can help them find the right verbal language to express how they feel, or we need to pick up on some of the struggles that maybe that youth has been holding in. And that is definitely true for kids, because kids, especially kids in school age kids, they don't want to be different. They don't want to be labeled. They are worried about what it might be like if they're crazy and they have to go for treatment. So they are a population that definitely hold in a lot. So by the time you meet somebody that's making that statement, you don't know how long they've been struggling and suffering.
Yeah. And I think from my perspective as well, there's definitely safety nets in place for parents. We're in the emergency department 24 hours a day, ready to take care of your child. And I always tell parents to follow your gut. You have a general sense of your child, probably more than anybody else, even the kids that are withdrawn, or even the kids that haven't been talkative. You know your child the best. So if you have a gut instinct about it, take it seriously. And there are ways to help. There's suicide prevention hotlines 24 hours a day. We have our local community lines, 262 HELP, for example. 201-262-HELP is always there to answer any concerns or address any questions. So if you're ever unsure about what to do, there's lots of resources for you, and you don't have to kind of muddle through it alone.
I think the schools have also been great resources because guidance counselors, SACs, and child study teams, they know what the resources in the county are. So I think sometimes parents might be hesitant to contact the school because they don't want the school to know their business or to treat their child any differently or to portray some confidentiality with their child. But honestly, we're talking about like something very important that we need to really look at what the benefits and the risk factors are to call the school and ask for supports and help. And we know in New Jersey, we have a children's mobile response.
Yes, that's
And every
huge.
county has a children's mobile response. So the parent can call Perform Care, who decides who gets what, 24/7 and say, my child's suffering. And Children's Mobile can go out to the home within an hour to try to link that child with immediate mental health help. So they're not waiting on a wait list or calling around different agencies trying to get therapy and being told it's going to take a couple months, because we need our children to have access to the right help, to be monitored, especially if they're coming into the ER, but they don't need to stay in the hospital. We want these youth to be monitored and have the treatment to help.
Yeah. And for a lot of you, you may not know, the emergency department is a bit of a scary place, especially now. Nobody knows what's happening with COVID. People are very hesitant to come in. But we keep it safe. We have put in a lot of safety measures for COVID. So that shouldn't be an issue for any parent who is questioning whether their child needs to be seen. And you know, the emergency department is a very foreign place for many people, especially for psychiatric emergencies. But we try to make it, you know, as easy as possible for everybody involved, because we know how stressful it is to both parents and the kids.
Any type of transition, whether it's from elementary school to middle school or middle school to college to, those transitions create more stress, and it is a very it is a risk factor in that person's life, because they have to make new supports, they have to make new friends, and they have to feel successful and that they matter. And I think that we need to do a lot more as far as giving prevention and supports and trainings and all the things that we know that would help a youth to feel that they're normal and that most of their peers feel the same way and they're not alone. So when a teen arrives in the emergency department with suicidal risk concerns, what is the course of action? What does the ER do as far as treatment?
Right. So, what you should expect if you were to come to the emergency department for something like this is that we initially start a medical clearance, making sure there's no medical reason for the behavior that's of concern. So that usually involves some blood work, maybe an EKG to look at the heart, maybe x-rays, urine tests. And after that process is kind of done and we know that there's not a medical concern, we have crisis intervention workers who are trained social workers or psychologists who come to the emergency department and evaluate the patient. And essentially, it gets you resources to take care of your child faster, better. A lot of parents run into the problem of they see something wrong with their child, they want to seek help, they don't know how to do it, or they call for appointments and there's no appointments for 2 months, and so we're the safety net for people. And when you come to the emergency room and you speak to one of the counselors, they'll do an assessment for your child to see if they're imminently at risk to themselves or risk to others, and basically help us decide how to proceed. Do they need to be hospitalized? Do they need an outpatient resource that could be helpful? And they kind of get them plugged into the system, more or less. They can provide resources either through the school, through the county, and maybe if you want to talk a little bit about the resources that are available outside of the immediate pathways, like therapists and psychiatrists. We have, you mentioned the mobile unit to kind of garner resources for patients, and there are emergency psychiatrists that end up filling in the gap between when you can get definitive care and
In New Jersey, probably 20 years ago, they created this children's mobile response system in every county to fill in the gaps of wait lists for mental health and psychiatric treatment. So we know that parents can call this number and access services. And when Children's Mobile opens a case, they have psychiatric appointments available ASAP. So if that child needs medicine, right, they can get an appointment and that doctor will follow them until they're linked with a regular outpatient psychiatrist long-term, and they can provide therapy. They have therapists that actually go into the home, meet the clients where they are to reduce any barriers to treatment, and that is minimum 12 weeks, and really are able to monitor and decide how we're going to get help long-term if that's needed, or how we're going to stabilize some of what's going on. And it doesn't cost money, and everyone has access to the Perform Care is the number you call, but to Children's Mobile is the service.
yeah. Do you think you want to maybe list off some resources that parents can use for their child that they think might be at risk?
Yes, I definitely would put the number up of Children's Mobile Response, which is run through Care Plus in Bergen County. And, but the number that is going to be put up is Perform Care, because that's how you access services to Children's Mobile. I think that's really important. Care Plus is a community mental health center. We have outpatients, we have groups that can be really beneficial for kids that are struggling and finding supports and ways to get assistance. And Care Plus, accepts all insurances and has a charity care component. So payment is not always a barrier to treatment. We also have a lot of different online supports. So the second floor helpline is a helpline. It's also a text line for youth, and it's a website. And if you go on the website, the second floor, you'll see that all these different problems that teenagers might have, someone else had the problem and wrote how they solved it or how they worked to make it better. And I think that's really important as far as hearing other people's stories of hope, because when you're depressed and having suicide ideation, hope is everything. So if we can offer our youth hope, then we're ahead of the game. And I know that we have the helpline, which is the hotline for suicidal feelings. Of course, 262 HELP is a screening center, and they can also give out a lot of resources if you don't really have a list with you and you're just trying to figure it out. And we know that schools really do have more connections to mental health services. They have a lot of schools, such as Care Plus, has partnered with 40 different schools, at least, maybe more, in Bergen County to have a full-time clinician in the school to really look and help and support that school population, because we know that academic success is important, but emotional success and social success is also extremely important. And we want to keep kids in their district thriving and getting the help. And we need professionals partnering and marrying with schools to be able to get that help.
Yeah, that's great. I mean, and listen, when you're in a situation where maybe your child has actually made an attempt, or you don't have time to go through all these numbers and figure out which resource to use, there's 911, and we're right there. So just remember, their help is always just a short phone call away.
And colleges also have counseling centers, and they've been really beneficial in their resources lately, because the JED Foundation is another great support service. They have a website and they have toolkits to work with colleges, all different schools, but specifically 19 to 24-year-olds that really do need, extra support. So, and helping build resiliency skills and help seeking skills. So they have a lot of great information. The Suicide Resource, SPRC, is another great website, and that's also toolkits for schools, and it gives you all this information and really great information about mental health issues and depression and different treatments that are available and what it looks like. And I really do think that the Trevor Project has to be one of the best resources for the LGBTQ population, because the Trevor Project is a 24/7 help, and they also are all trained therapists on the phone to help youth struggling with LGBTQ related mental health concerns, and they have a website as well for supports and inclusive type of activities to connect kids with each other for extra resilience and support if you're struggling and worried and feeling that you don't matter, or that your life doesn't matter. So the Trevor Project is also a great resource.
In general, it's a little bit overwhelming for parents, and parents are going through a lot as well between the pandemic and taking care of their own mental health. But I think the upshot is that we really have been a lot more, as a medical community, not only aware of the need for psychiatric care for these kids, but the pandemic has really, it's almost allowed people to feel more comfortable seeking help for this type of thing, because there's been a lot more discussion about it. So I think stigmas are slowly being dropped away, and knowing that there is hope for these kids, and we're always going to have available help for everybody 24/7. So,
and I think that if we know that the second leading cause of death amongst teenagers is suicide, higher than homicide, so if we know that, what can we do to put in protective factors? We know that the more risk factors someone has, the more protective factors we need to wrap that youth in. There's internal protective factors, such as spiritual, having faith, having resiliency and coping skills, and there's external protective factors. And the external might be having a pet that needs me, having a parent that would be sad if I left. And we need to really look at how we can instill more protective factors for the youth we know are more at risk. And if we can do that, and if we can have parents and schools know how to have a conversation with someone struggling, how to link that person and tell them, I'm here for you, it's going to be okay, I have a number, I care about you, I'll follow you through. I think with all that we're trying to do, I think we can at one point, have a lot less children have to die by suicide or untreated depression and anxiety disorders. And I do believe the work is really happening, and I'm really excited to partner with someone like you, doctor, in a medical field, because with us together and medical and psychiatric services and mental health services, I think that they do overlap and they mimic each other, and the partnerships treatments will be richer.
Yeah.